morning, and thanks for joining us on The Real Story. I'm Emma Wulfhorst. Joining me now is the Vice President of Systems Innovation and Financing at the Connecticut Hospital Association, Mark Schaefer. Mark, thank you so much for being here with us.
Delighted to be here.
Wonderful. So we mentioned the State Hospital Association has come out with this new report. It's looking into that impact of the pandemic on hospitals. Can you tell me, big picture, how does a hospital in Connecticut look and operate differently now since COVID-19?
Well, since COVID-19, they're facing an enormous amount of pressure to be able to basically to run their businesses in a way that don't have losses that generate their ability to provide access. So to give you an example, workforce shortages make it really hard to staff all of what's needed to be staffed for inpatient and outpatient services, and those are driving up labor costs. Drugs and supplies and other costs are subject to the same inflation that every household is subject to, and so those are also making it very difficult for them to basically to manage financially.
You mentioned costs going up and hospitals aren't making as much money now. What are some of those factors at play here?
So supply costs that I mentioned and the labor shortages are some of the biggest costs. Also, the patients that are coming in today are sicker than they were before the pandemic, and they're staying longer in part because the workforce shortage has rippled throughout the industry. So if you have folks who need post-acute care, post-hospital care in a nursing facility or such, those facilities may not be able to take those patients back. So that makes it very expensive to do business and harder to cover your costs without a loss.
Sure. So what do you think needs to be done now this legislative session? We have about 5 weeks left. What were some of the priorities there?
Well, we're looking for the legislature to assist us with some of the avoidable costs, like the aggressive authorization practices of insurers that are adding really waste and inefficiency to running a hospital. We're looking for a lot of support for recruitment and retention and training of the workforce to make sure that we can afford to do all of what's needed to basically to fund the workforce and also to build the workforce for tomorrow. So those are just a couple of things that we're looking for. In addition, we're looking for solutions that would involve Medicaid, because one of the biggest pressures on hospital finance is how little governmental payers pay for services. And in Connecticut, Medicaid pays about 64 cents on every dollar. So in Medicaid, we lose more than nearly $1 billion a year in uncovered costs when we serve Medicaid patients. Similar number for Medicare, and that's something that we really think needs attention paid, because if we can address the Medicaid underpayment, it can take some of the pressure off of commercial prices and support our goals for affordability.
With Medicaid, what needs to be done there? How can that be addressed?
Well, so one of the things that could happen in Medicaid, just to give you as a point of comparison, we looked at Medicaid spending in other northeastern states, and we spend about 27% less on Medicaid. So one of the things we can do is right-size our investment in Medicaid, not just hospitals, but in the entire service delivery system. What that does is that brings in federal dollars. By underspending to the tune of 27% for the past 6 years, we've left $7.5 billion in federal revenue on the table that could be helping to support the care delivery system and better care for Medicaid.
And have there been conversations about that? Has that been brought to the table at all?
That is something we have. We've opened that conversation, and I'm hopeful that there will be real appetite amongst legislators and the administration to think long view. And there's two other things about that investment. So we underinvest now, but that also represents an opportunity to invest strategically to drive better health outcomes, not just for Medicaid patients, but also for the people who live in communities that have some of the highest health risk. And so one of the things we're really thinking about is there more that we can do to focus our attention on the root cause drivers of poor health, because diabetes is at epidemic levels right now, severe obesity and cardiovascular disease. And so we believe that hospitals in partnership with communities in the state could really make an impact on the things that drive how many people need services.
Right. So healthcare, obviously a big topic at the state capitol this session, and some other legislation that the legislators have been talking about. Governor Lamont making lowering healthcare costs a priority. He's pushing an anti-competitive healthcare practice bill in the Senate. That bill's gotten a lot of support from lawmakers, meant to restrict anti-competitive contract practices, cap out-of-network charges, improve transparency, a lot more. But the Hospital Association is telling people not to support it. Why aren't you happy with that proposal?
Well, we see those as kind of blunt force instruments to create savings at a time when hospitals are experiencing their worst operating margins, their greatest losses in 8 years. And not just the hospitals, but the health systems that they're a part of, the physician networks and that sort of thing. These losses are historic. And at this time, when you're struggling to maintain a workforce sufficient to ensure access for everybody, because hospitals serve everybody who walks through their doors, this is not the right time to be looking to short circuit the planning process that's needed to put into place long-term solutions.
Gotcha. So you brought up staffing shortages again there. Let's talk about that. Lawmakers are looking at ways to recruit more people into the field, to bring more workers in, maybe providing incentives for those to come work in Connecticut hospitals. The association's report, though, says the solution most hospitals are using right now is temporary contracted workers. But is that causing some problems?
Well, the temporary contracted workers are, it's not as good as having a trained employed workforce as part of the ongoing team. They're much more expensive, substantially more expensive than if you can recruit locally and have folks on your workforce for the long game. So we are looking to reduce, all the hospitals are trying to reduce their reliance on temporary staffing, but we can only do that if we can address the pipeline of individuals who need to get sort of trained and prepared to enter this important area of service. And
what do you think are some ways to do that? Is it looking at things like incentives? Is it looking at maybe speeding up licensure? What, and training for nurses? What can be done there?
Well, I think that there are loan forgiveness approaches. There are ways to create compensation packages that are more attractive, and also working with the colleges and universities to make it possible to precept more individuals, to get them to basically be able to accelerate by virtue of the number of people who are being trained and coming into the market.
And that's long-term solutions, but do you think there are too many long-term solutions in the legislature right now and maybe not enough short-term? And if so, what can be done in short-term to help hospitals?
Well, in the short term, I think that what I mentioned about the administrative practices of payers that are making it that are expensive for hospitals and also result in lower reimbursement than is deserved. Mm-hmm. There are investments that the legislature could make now that helps to defray some of these immediate expenses of recruiting and retaining and rewarding the workforce. Those are a couple of examples, and then not advancing proposals that jeopardize hospitals' ability to stay the course and to basically build out and support these longer game solutions.
Well, we're out of time now, but thank you so much, Mark, for being with me this morning.
It's been a pleasure.